This patient was thinking of replacing his two lower and central incisor teeth with implants. He was aware that there was a gum problem and he was seeking treatment, but clearly his thinking was wrong and he needed professional guidance. Is there another factor in the etiology, besides the accumulation of plaque and calculus, that is contributing to this very strange pathological change in the soft tissue? Diagnostic study casts offer another perspective to looking at the problem, which will now be demonstrated. The gross accumulation of plaque and calculus on all the teeth is clearly visible, with an extensive accumulation on the lower and central incisors, causing an alteration of the gingival anatomy and inflammation. Throughout the whole mouth there was plaque accumulation with marginal gingivitis, indicating that the patient was a candidate for definitive periodontal treatment, which would involve oral hygiene instruction, plaque control, root planing, and then the consideration of gingival grafting for the lower central incisors. These teeth had no mobility, and although x-rays were not taken at this stage, there seemed to be no hint that there was extensive bone loss around these teeth. The study models show a class 2 division 2 occlusion with a marked overbite. Also very clearly demonstrated is the change in the soft tissue anatomy. Specifically on the upper central incisors, from lateral to lateral, there is marked hypertrophy of the soft tissue with incomplete passive eruption. Around the lower central incisors, there's also marked gingival recession buccally. This is clearly demonstrated. Turning the study models around allows one to visualize the extent of the occlusal change. Clearly, the extensive overbite is an aggravating factor in causing the soft tissue lesion and needs to be attended to as part of the comprehensive treatment plan. The wear facetting on the palatal aspect of the upper central incisors is so much more clearly delineated and visualized in study casts as opposed to looking at it in the mouth when the teeth are covered with saliva. The curve of Spee, as demonstrated in the upper two slides, will be treated as part of the orthodontic treatment. Also notice the over-eruption of the lower central incisors, which again will be dealt with in the orthodontic phase of treatment by bringing them back into proper alignment with the lower arch. The treatment is basically one of periodontal treatment and orthodontics. It is important to stage the treatment in such a way that each step is properly integrated. One starts off with oral hygiene instruction, plaque control, and root planing. This will allow the soft tissue to respond and evaluate to what extent soft tissue grafting needs to be done. It is important thereafter to do the orthodontic treatment in an environment which is completely plaque-free, and only once the occlusion has been settled does one then begin with soft tissue grafting.